I'm Rich Fellner.
I'm Brenda Beasley.
My name is Cherie Brackett.
My name is Thomas Beasley.
First symptom was severe indigestion, which was not fixed by an antacid.
First thing was the chest pain. I noticed that almost immediately. It was very uncomfortable. Felt like somebody was standing on my chest.
Seemed like it was getting tighter, like a fist was in there. It was like something was just crushing it.
Then came profuse sweating just out of nowhere.
Pain radiated right up into my jaw, and then down into my arm and fingertips.
And all of a sudden, you can't breathe, and you start sweating, and your chest started hurting. Something's wrong.
Then a sense of doom that the whole world was coming to an end.
Was very scared, had decided that it was time to tell my wife. It was time to go to the hospital and, see if it was, in fact, what I feared, which was a heart attack.
I told my wife, I have never felt this way, and I was serious when I told her this too. I said, it's time to go. She probably looked at my face and said, he's not playing.
He was sweating, and things that he never did before that made me know something was wrong.
It's important to know what to do when someone that you love becomes pale or sweaty and has chest pains.
It can happen to anybody, and it can happen overnight. It can happen in the blink of an eye. I'm just very glad to be here telling the story, and that I knew what to look for.
Sometimes I get a little emotional. When I talk about it, it's not usually a tear drop out my eye, because this was real serious.
So I immediately got help. I went to someone at the front of the store and asked them to call 911 for me. And within 15 minutes, I was in the hospital emergency room being treated for a heart attack.
Because it can happen at any time and anywhere, and you just don't know when it's going to happen.
I'm glad to be here today.
He's my beat. He's my beat. And I love him. I love him a lot.
Cardiac emergencies are life-threatening. Heart attack and cardiac arrest are major causes of illness and death in the United States. Following the cardiac chain of survival by recognizing the signals of a cardiac emergency, calling 911 or the local emergency number and giving immediate care saves lives. Performing CPR and using an automated external defibrillator, or AED, immediately after a person goes into cardiac arrest can greatly increase his or her chance of survival.
Oh, Jada. Sandra, help. It's Jada.
Jada? Tony, bring me my bag, please. Jada, can you hear me? Jada? All right, looks like she's unconscious. Call 911.
There are 4 links in the cardiac chain of survival that guide any response to a cardiac emergency: early recognition and access to the emergency medical services system, early CPR, early defibrillation, and early advanced medical care. The first link in the cardiac chain of survival is early recognition and access to the EMS system. Recognizing a cardiac emergency and activating the emergency medical services system gets help on the way quickly. Early CPR is the second link in the cardiac chain of survival. Performing CPR keeps blood containing oxygen flowing to the brain and other vital organs. The third link in the cardiac chain of survival is early defibrillation. Early defibrillation from an automated external defibrillator, commonly called an AED, may help to establish an effective heart rhythm and significantly increase the patient's chance for survival.
Shock delivered.
Early advanced medical care is the fourth link in the cardiac chain of survival. Professional responders can provide the knowledge, equipment, and medications to continue the life-saving care you have already given. In a cardiac emergency, when every second counts, responding quickly using the 4 links in the cardiac chain of survival can mean the difference between life and death. Every year, thousands of people die of sudden cardiac arrest.
She's unconscious. Go to the front desk, call 911, and bring me the AED.
Following the links of the cardiac chain of survival can help save lives. The sooner 911 is called, the sooner advanced medical care will arrive. Early CPR helps circulate blood that contains oxygen to vital organs. Most people experiencing sudden cardiac arrest need an electrical shock called defibrillation. Continue CPR until an AED is ready to use.
12, 13, 14, 15.
An AED, or Automated External Defibrillator, is a portable electronic device that analyzes the heart's rhythm and determines if an electrical shock is needed to help the heart restore an effective rhythm. Most AEDs can be operated by following these general instructions. Turn on the AED. The AED will tell you what to do next.
Press pads firmly to patient's bare skin.
Make sure the person's chest is bare and dry. Use a cloth or gauze pad to dry the person's bare skin where the pads will be placed. Remove the pads from their packaging. Carefully peel off the backing from one pad and place the pad on the upper right chest. Place the other pad on the left side of the chest. Plug in the connector to the AED if necessary. The AED should start analyzing the person's heart rhythm.
Analyzing heart rhythm. Do not touch patient.
Analyzing.
Do not allow yourself or anyone else to touch the person while the AED is analyzing.
During shock, move away from the patient.
Make sure that no one, including you, is touching the person.
Press red flashing button to deliver shock. Shock delivered. It is now safe to touch the patient. Start CPR.
After a shock is delivered, or if no shock is advised, give about 2 minutes or 5 cycles of CPR. When 2 minutes have passed, the AED should automatically begin to reanalyze the heart rhythm and will advise you with a prompt to stay clear of the person.
Do not touch patient. Analyzing heart rhythm.
Continue to follow the prompts of the AED and provide care as needed.
It is now safe to touch the patient. Start CPR.
If at any time you notice an obvious sign of life, such as breathing, stop CPR, maintain an open airway, and monitor for any changes in condition. An AED can also be used for children and infants who are not breathing. Use pediatric pads if they are available. Operate the AED and apply the pediatric pads to the child's chest the same way you would for an adult.
Do not touch patient. Analyzing heart rhythm.
Analyzing. Everyone stand clear.
For a small child or infant, the pediatric pads may be too large to fit on the chest without touching each other. You may need to attach one pad on the center of the chest and the other on the back between the shoulder blades. Here is how you would work with a second trained responder when using an AED. One responder continues CPR while the other prepares the AED. This is another example of how CPR and an AED work together as links in the cardiac chain of survival. One responder continues CPR while the other attaches the AED pads and operates the AED.
Do not touch patient. Analyzing heart rhythm.
Everyone stand clear.
Preparing shock. Move away from the patient.
Shock advised. Everyone stand clear.
Press red flashing button to deliver shock. Shock delivered. It is now safe to touch the patient. Start CPR.
Knowing how to correctly perform CPR will help you provide care to a person having a cardiac emergency until another trained responder or EMS personnel take over. First, you will learn how to give effective CPR compressions. Then we'll add giving rescue breaths. Finally, we will practice some cycles of CPR. This video is designed so you can practice the skill while you watch it. However, your instructor may ask you to practice the skill after watching the video. If so, watch closely. You'll practice soon. Now get ready to practice CPR. Position yourself next to the mannequin with your gloves on and your CPR breathing barrier ready. First, place the heel of one hand in the center of the chest along the breastbone. Then, place the other hand on top and lace your fingers together. Position your shoulders directly over your hands. Keep your arms as straight as possible and your fingers up and off the chest. Push hard and fast in the middle of the chest, at least 2 inches deep. Now, give 30 chest compressions. Try to keep an even pace. The compression should be at a rate of at least 100 per minute. Counting out loud can help you. Ready? Go.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11.
Each compression should be smooth. Let the chest rise completely before pressing down again. Don't take your hands off the chest, just your weight. Okay? Stop. Give another full set of 30 compressions. Remember, keep an even pace. The recommended rate is at least 100 compressions per minute. Ready? Go.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12 and 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29.
Okay. Stop. CPR is performed in cycles of 30 chest compressions and 2 rescue breaths. To give rescue breaths, use a CPR breathing barrier if available. Tilt the head back and lift the chin up. Then pinch the nose shut and make a complete seal over the mouth. Blow in for about 1 second. Watch for the chest to rise and fall with each breath. If the chest does not rise, re-tilt the head and try another rescue breath. Your instructor will pause the video and help you practice giving rescue breaths. Now, practice doing cycles of 30 chest compressions, followed by 2 rescue breaths. Get into position. Place your hands on the center of the chest, fingers laced and up. Ready? Go.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12 and 13, 14, 15, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13. 14,
Okay,
15.
stop. Your instructor will pause the video to give you some feedback. When we begin again, we'll put together all the pieces you've learned to simulate a real response. Now let's simulate a real response, from checking the scene to checking an unconscious person and through a few cycles of CPR. Stand a few steps away from your mannequin. Your gloves should be on, and you should have a CPR breathing barrier ready to go. On my cue, check the scene for safety, then check the unconscious person. You will be given only the information necessary to make a decision about what to do next. Ready? Go. The scene is safe.
Are you okay? Are you okay?
There is no response.
Call 911, this person's unconscious.
1 1000, 2 1000, 3 1000, 4 1000, 5 1000, 6 1000, 7 1000, 8 1000, 9 1000.
There is no breathing.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1 and 2 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12 and 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10, 11, 12 and 13, 14.
Do not stop CPR except in one of these situations. You notice an obvious sign of life. An automated external defibrillator or AED is ready to use. Another trained responder or EMS personnel take over. You are too exhausted to continue. Or the scene becomes unsafe. There are two distinct differences between performing CPR on an adult and performing CPR on a child. After checking for breathing, give 2 rescue breaths. Then quickly scan for severe bleeding and start chest compressions. Adults do not receive these 2 initial rescue breaths. Second, when performing chest compressions on a child, push down about 2 inches. For adults, push down at least 2 inches. Hand position and speed when performing compressions are the same for adults and children, as well as the CPR cycle of 30 chest compressions, followed by 2 rescue breaths.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13.
When something is lodged in someone's throat, the natural response is to cough. If the person is coughing forcefully, he's getting air. Encourage him to keep coughing. If a conscious adult or child can no longer cough, speak, or breathe, he may be choking. Have someone call for help and obtain consent. A conscious adult or child who has a completely blocked airway needs immediate care. Using more than one technique is often necessary to dislodge an object and clear a person's airway. A combination of 5 back blows, followed by 5 abdominal thrusts, provides an effective way to clear the airway obstruction. To avoid injury, never give actual back blows or abdominal thrusts to someone who is not choking. These techniques are simulated for training purposes. Provide support by placing one arm diagonally across the chest. Bend the person forward at the waist so his upper airway is at least parallel to the ground. This will help ensure that the object will not go back down the person's throat. Using the heel of your other hand, give 5 firm back blows between the shoulder blades. If the 5 back blows do not clear the airway, give 5 abdominal thrusts. Standing behind the person, use 1 or 2 fingers of one hand to find the navel. Make a fist with your other hand and place the thumb side of your fist just above the navel, in the middle of the person's abdomen. Grab that fist with your other hand. Give 5 quick, upward thrusts. Continue to give 5 back blows and 5 abdominal thrusts until the object is dislodged, the person can cough forcefully, speak or breathe, or the person becomes unconscious. If the person becomes unconscious, gently lower him to the ground, protecting his head on the way down. You may need to kneel behind a child to give effective back blows and abdominal thrusts. Do not use as much force with a child. To care for an unconscious adult or child who is choking, use a modified CPR technique.
26, 27, 28, 29.
If the chest does not clearly rise with rescue breaths, the airway could be blocked. Re-tilt the head and give another rescue breath. If the chest still does not clearly rise, assume the airway is blocked by a foreign object. Remove the CPR breathing barrier and give 30 chest compressions.
29, 30.
Open the person's mouth. If you see an object, remove it with your finger. If you have removed an object or you can't see one, give 2 rescue breaths. Repeat this cycle of giving 30 compressions, looking for an object, and giving 2 rescue breaths until the chest clearly rises with the rescue breaths. If the breaths make the chest clearly rise, remove the CPR breathing barrier and check for breathing for no more than 10 seconds.
1,004, 1,005, 1,006, 1,007, 1,008, 1,009, 1,010.
Here's what the sequence looks like for a child.
One and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12 and 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000, 7, 1,000, 8, 1,000, 9, 1,000, 10, 1,000.
When you find a person who appears to be unconscious, follow the emergency action steps. Check, call, care. Check the scene for safety. For a child, obtain consent from a parent or guardian if present. Then check the person for responsiveness. If the person doesn't respond, call for help. If the person is face down, gently roll the person face up, keeping the head, neck, and back in a straight line so you can provide care. Once the person is on her back, open the airway by using the head tilt, chin lift technique. To perform the head tilt, chin lift technique, place one hand on the forehead and 2 fingers on the bony part of the chin. Then tilt the head back as you lift up on the chin. Maintain this position. For a child, do not tilt the head back as far as you would for an adult. Check for breathing for no more than 10 seconds. Look to see if the person's chest clearly rises and falls. Listen for escaping air from the mouth and nose. Feel for escaping air against the side of your face. Normal, effective breathing is quiet, regular, and effortless. In an unconscious adult, you may detect an irregular, gasping, or shallow breath. This is known as an agonal breath. Do not confuse this with effective breathing. Care for the person as if there is no breathing at all. If an adult is not breathing, quickly check for severe bleeding, then begin chest compressions. If a child is not breathing, give 2 rescue breaths, one after the other, before checking for bleeding and giving care for the conditions you find. Use a CPR breathing barrier if available. Tilt the head back and lift the chin up. Then pinch the nose shut and make a complete seal over the child's mouth. Blow gently for about 1 second. Each breath should make the chest clearly rise. If the chest does not rise, re-tilt the child's head and try another rescue breath. After 2 successful rescue breaths, quickly scan the body for severe bleeding and care for the conditions you find. If at any time an unconscious person begins vomiting, the airway could become blocked. Roll the person onto one side, and then use a finger to clear out the mouth. Once the mouth is clear, continue to provide care based on the conditions you find. If the person is unconscious but breathing, maintain an open airway with the head tilt, chin lift technique, and monitor breathing and for any changes in condition until EMS personnel take over. If you cannot maintain an open and clear airway because of fluids or vomit, place the person in a modified Haynes recovery position by moving the person to her side while keeping the head, neck, and back in a straight line with the knees bent. If you need to leave the scene to call 911, Modify this position by tucking the hand under the head. Determining how to help a person who becomes suddenly ill can be difficult. Some illnesses can strike with no warning, including fainting, seizure, stroke, diabetic emergency, allergic reactions, poisoning, and fever. Common signals of sudden illnesses include dizziness or unconsciousness, trouble breathing, signals of a heart attack such as chest pain, discomfort, or pressure that may spread to the shoulders, arm, neck, jaw, stomach, or back. Signals of a stroke, such as sudden weakness on one side of the body and sudden trouble with speaking or getting words out, loss of vision or blurred vision. Signals of shock, such as rapid breathing and ashen skin. Sweating, persistent abdominal pain or pressure, nausea or vomiting, diarrhea, or seizures. Certain sudden illnesses require specific care. In general, to help a person experiencing a sudden illness, do no further harm. Monitor breathing and consciousness. Help the person rest comfortably. Keep the person from getting chilled or overheated. Reassure the person, and give any specific care needed. Call 911 or the local emergency number for the following conditions: unconsciousness or altered levels of consciousness, trouble breathing or no breathing, signals of a heart attack, persistent abdominal pain or pressure, severe external bleeding, vomiting blood or passing blood, severe or critical burns, suspected poisoning, seizures, stroke, suspected or obvious injuries to the head, neck, or spine, or painful, swollen, deformed areas, or an open fracture. A seizure is the result of abnormal electrical activity in the brain that causes temporary, involuntary changes in body movement, function, sensation, and awareness or behavior. Most seizures last only a few minutes and can include the following signals: a blank stare, a period of distorted sensation during which the person is unable to respond, uncontrollable muscular contractions called convulsions. Call 911 or the local emergency number if the seizure lasts more than 5 minutes. The person has multiple seizures with no signs of slowing down. The person appears to be injured or fails to regain consciousness after the seizure. The cause of the seizure is unknown. The person is pregnant. The person has diabetes. The person is a young child or an infant who experienced a febrile seizure. The seizure takes place in the water. The person is elderly and could have suffered a stroke. Or the person has no known history of epilepsy or seizures. If a person is actively seizing, remove nearby objects that could cause injury, protect the person's airway, and allow the seizure to run its course. Attempting to stop a seizure or restrain the person can cause injuries. Do not place objects or fingers into the mouth of an actively seizing person. Recovering from a seizure usually takes just a few minutes. The person may be disoriented and drowsy. Reassure the person as you monitor his condition.
What's your name?
A fever occurs when a person's body temperature is higher than 100.4 degrees Fahrenheit. Fevers are common in children and infants. Signals of fever include skin that is hot to the touch, chills and body aches, headache, trouble sleeping or oversleeping, drowsiness, and lack of appetite. Additional signals for infants include being fussy and crying, becoming listless, and rapid breathing. Young children and infants with a fever over 103 degrees Fahrenheit can experience a heat-induced seizure called a febrile seizure, lasting less than 5 minutes. Febrile seizures are not usually life-threatening and produce different signals, which include a sudden rise in body temperature, change in the level of consciousness, rhythmic jerking of the head and limbs, confusion, drowsiness, crying out, becoming rigid, holding his or her breath, an upward rolling of the eyes. Call 911 or the local emergency number if the child or infant with a fever has signals of a life-threatening condition, such as unconsciousness or trouble breathing. For a child who has experienced a febrile seizure, call 911 if it's the child's first seizure, or if the seizure lasts longer than 5 minutes, is repeated, or is followed by a quick rise in temperature. Infants younger than 3 months with any fever, and children less than 2 years with a high fever greater than 103 degrees Fahrenheit, require immediate evaluation by a healthcare provider. If the child or infant has a fever, make him as comfortable as possible. Encourage rest and make sure he drinks plenty of clear fluids. If the child has a high fever, gently cool him. Never rush cooling down a child. If the child experienced a febrile seizure, rapid cooling could bring on other complications. Remove excess clothing or blankets and give him a sponge bath in lukewarm water. Comfort him as you monitor for changes in his condition. Before giving a child any medication such as acetaminophen, contact a healthcare provider. Do not give aspirin to infants or children under 18 years old. Aspirin has been linked to Reye's syndrome, a serious medical condition that affects the brain and other internal organs. A stroke or brain attack occurs when blood flow is blocked from reaching part of the brain. A stroke can cause permanent damage to the brain if not treated soon after the onset of signals. A person experiencing a stroke needs immediate medical attention. When a person is suffering a stroke, she can experience weakness or numbness of the face, arms, or legs, severe unexplained headache, facial droop or drooling, difficulty speaking or comprehending, vision loss or disturbance in one or both eyes, dizziness, confusion, agitation, loss of consciousness or other severely altered mental status, loss of balance or coordination, trouble walking, or incontinence. For a stroke, think fast. Face, arm, speech, time. F stands for face. Ask the person to smile, then check to see if one side of her face droops. A is for arm. Ask the person to raise both arms to check for weakness or numbness in one arm. Watch for one arm to drift down. S means speech. Ask the person to repeat a simple sentence. Is the person slurring the words or able to repeat the sentence correctly? T stands for time. Make note of the time the signals first appeared. If the person shows any signs of a stroke, call 911 or the local emergency number right away. Care for any conditions that you find until EMS personnel take over. Reassure the person and have her rest comfortably. Do not give her anything to eat or drink. Continue to monitor the person and note any changes in her condition. Relay all the information to EMS personnel when they take over.
Okay.
Shock is a life-threatening condition that occurs when a person's body is struggling to meet demands for oxygen and blood supply. The signals of shock present themselves in different parts of the body. The person can feel apprehensive or anxious in the early stages of shock, then grow listless and confused and be unable to speak as shock worsens. Breathing might start at a rapid rate, then become slow, shallow, and irregular if shock progresses. Body temperature will decrease slightly at first. As shock worsens, body temperature will drop much lower than normal. Skin will feel cool and appear ashen or pale, then grow colder, paler, and clammy. Pulse rate will increase slightly in the early stages of shock and change to rapid, weak, and irregular as time elapses. As shock worsens, the person's organs can shut down, which can cause death. Calling 911 immediately and minimizing shock can save a person's life. Here are some steps to minimize shock. Make sure that 911 or the local emergency number has been called. Have the person lie down. Since you may not be sure of the person's condition, leave him or her lying flat. Control any external bleeding. Help maintain normal body temperature. Reassure the person until a trained responder or EMS personnel take over. Don't give the person anything to eat or drink, and monitor the person for changes in condition. When a person's skin is broken and bleeding, she has an open wound. Most open wounds will stop bleeding on their own after a few minutes. In cases of severe bleeding, have someone call 911 or the local emergency number immediately. Check the scene for safety. Obtain consent to give care. Check the person. Follow standard precautions, including gloves and other personal protective equipment when providing care. Cover the wound with a sterile dressing or clean cloth. Apply pressure on the wound until the bleeding stops. Wrap a roller bandage around the dressing to secure it in place and keep pressure on the wound. Start from the end farthest from the heart. Overlap the roller bandage several times to completely cover the dressing. Tape or tie off the end of the bandage to keep it in place and keep pressure on the wound. If bleeding does not stop, do not remove the blood-soaked bandages and dressings. Apply additional dressings and bandages and continue to apply pressure. Do not attempt to wash or clean a severely bleeding wound. Your first priority is to control the bleeding. Take steps to minimize shock and call 911 or the local emergency number if you haven't already done so. In cases where an object is embedded or impaled in a person's skin, caring for the wound is slightly different. Do not remove the object. Removing it may cause more damage. Keep the object and the body part still. Place gauze dressings around the object. Lightly press the area around the wound, but do not press on or move the object. Surround the object with bulky dressings to keep it from moving. Carefully wrap a roller bandage over the dressings and around the object, but do not cover the object itself. Overlap the bandage until the dressings and object are completely secure, then tie or tape the bandage in place. Monitor the person's condition until a trained responder or EMS personnel take over. If bleeding continues, apply more bandages and maintain pressure. When people injure muscles, bones, and joints, there could be broken bones, strained muscles, or sprained or dislocated joints. An injury to muscles, bones, or joints may be severe if the person cannot use the body part, heard a snap, pop, or experienced grating bones or a loss of feeling in the area. You see bone fragments, swelling, and deformity, or notice that the incident itself caused severe injury. Call 911 or the local emergency number if a muscle, bone, or joint injury appears to be severe. The general care for a muscle, bone, or joint injury involves following RICE: rest, immobilize, cold, and elevate. Rest: do not move or straighten the injured area. Immobilize: stabilize the injured part in the position it was found. Minimize movement to prevent further injury. If you need to transport the person to get medical care, splint the injured body part unless applying the splint causes more pain. Cold: apply an ice pack to reduce swelling and pain. Place a thin barrier between the ice and the person's skin. Keep ice on the injured area for about 20 minutes if tolerated. Elevate: if there is no pain, gently elevate the person's injured body part, which may help reduce swelling. Do not elevate the injured part if it causes more pain. Splinting should only be used if you need to move or transport the person to seek medical attention, and if it does not cause more pain. 2 things to remember when working with splints. Apply splints to immobilize the areas above and below the injury. Do not try to straighten the body part. Instead, splint the body part in the position found. There are multiple types of splints, including anatomic, soft, sling and binder, and rigid. Anatomic splints immobilize an injured body part using an uninjured neighboring body part. Support the area above and below the site of the injury. Check beyond the injured area for feeling, warmth, and color. If the person is wearing a shoe, do not remove it. Place folded triangular bandages above and below the injured area. Move the uninjured body part next to the injured body part. Tie the bandage securely. Do not tie the ends directly over the injured area. Recheck beyond the injured area for feeling, warmth, and color to make sure the splint is not too tight. If the person loses feeling or her skin turns pale, cold, or blue, loosen the splint. Soft splints, such as folded blankets, towels, or pillows, work well to immobilize injured ankles and forearms. Support the area above and below the site of the injury. Check beyond the injured area for feeling, warmth, and color. Place folded triangular bandages above and below the injured area. Gently wrap a soft blanket or folded towel around the injured body part. Tie triangular bandages gently with knots. Tie the bandage securely. Do not tie the ends directly over the injured area. Recheck beyond the injured area for feeling, warmth, and color to make sure the splint is not too tight. A sling and binder can be used to immobilize injured arms and shoulders. Support the arm above and below the site of the injury. Check beyond the injured area for feeling, warmth, and color. Thread one end of a triangular bandage under the injured arm and over the uninjured shoulder to form a sling. Tie the ends of the sling together at the side of the person's neck. Pad the knot for comfort. Bind the injured body part to the chest with a folded triangular bandage to keep the injured area stable. Recheck beyond the injured area for feeling, warmth, and color. If the binder is too tight, loosen it. Rigid splints, such as padded boards, folded magazines, or padded metal strips that do not have any sharp edges, can be used to immobilize injured areas. Support the arm above and below the site of the injury.
Okay, just keep your arm steady.
Check beyond the injured area for feeling, warmth, and color. Place the rigid splint under the injured area. Immobilize the elbow as well as the forearm. Place a roller bandage in the person's hand to keep it in a natural resting position. Tie folded triangular bandages above and below the injured area. Recheck beyond the injured area for feeling, warmth, and color. If it's a forearm injury, bind the arm to the chest using folded triangular bandages or apply a sling.